Hello, are you Brutus?
Yes.
Hi, I'm Jenny. I'm going to be your nurse today. I hear that you just had a recent surgery.
Yes.
Okay, and what kind of surgery do we have
A
then?
hip surgery.
Okay. Have you had a hip surgery before?
No.
Okay. So what's going to happen is we're going to discharge you to go home today, okay?
Alright.
And I was wondering, do you have any questions about what happens?
No.
Okay. So when we go home, we're going to give you some medication to help you manage your pain. Are you currently having any pain?
No.
Okay. Do you have anybody at home that can help you with your care?
My beautiful wife, Bertha.
Oh, she is lovely. What a lovely wife you have. Okay, so I'm going to be talking to you too, Bertha, and letting you know the instructions to help care for your husband, okay?
Okay.
So we are going to be controlling your pain. So do you have any allergies to any medications?
No.
Okay, good. I see that you might be suffering from some anxiety. Just so you know, this medication might also cause options of anxiety. So if that happens, just let your doctor know, okay? We're going to make sure that you are drinking plenty of fluids while you're taking this medication. It can cause dryness of your mouth, and we want to make sure that you're having enough fluids to maintain a good, but we also, we're going to try to avoid alcohol while we're taking this medication. Okay, thank you. So, do you have any kidney or liver problems?
No.
Okay, good. I'm going to give you a listen to your lungs. Do you have a history of asthma or COPD?
Yes.
Okay, can you take a couple of breaths for me, please? Okay, everything sounds good. Is your doctor managing your asthma well?
Yes.
Okay, that's good to hear. Your lungs sound clear on both sides. Just so you know, as long as we keep your pain at a minimum, it's going to promote healing for that hip, okay? Because stress and anxiety, like you were feeling before, that can keep yourself from healing properly. So we're going to make sure that we're not doing that. As soon as you start to feel pain, you need to let Bertha know so she can give you your pills.
I will make sure.
Okay, thank you, Bertha. I just want to see if you're able to open this bottle so I know what kind of bottle we can give you. Okay, looks like you're having some trouble. Here, try this kind of bottle. Okay, we'll make sure we give you that kind of a bottle. Are you able to swallow pills okay?
Not really.
Okay, that's good. We'll make sure that we're not giving you an extended release, because then you'll be able to crush this medication. You can add it to food, okay?
Alright.
The doctor is going to prescribe a medication, and you'll be able to pick it up at the pharmacy, probably when you leave here. Alright. It's going to be on a schedule, but then you'll also be able to take some if the pain gets worse than usual, alright? We don't want the pain to get out of hand, because we want to keep it at a level where you can keep functioning and keep getting better, okay? Sometimes people develop addictions to medication. Is that a concern of yours?
A little bit, not really.
Okay, yeah, this medication, it's a low level, so it shouldn't cause addiction as long as you're using it properly. If you feel like you start to rely on it, then let the doctor know. We can always make a change, okay? Yeah, because if you have an attitude of where you're afraid to take it, that might hamper your ability to heal and use it properly, okay? Sometimes it can cause things to happen that you don't want to happen. It can cause disturbances in sleep, cognitive changes, diminished functional abilities. It can cause excessive sleepiness.
What?
Yeah, so if you feel excessively sleepy, you just let your doctor know, okay?
Okay.
Everybody has a different pain threshold, so you might feel pain more than somebody else. So, Bertha, I need you to realize that if Brutus says he's feeling pain, you need to trust that that pain is real, okay?
Okay.
Alright. So, if you start to feel anxious, or if Bertha's not around or she needs to go grocery shopping, there's things you can do to help minimize your stress and anxiety. You can listen to music, you can deep breathe, which is really important because this does kind of bring your breathing down a little slower. So we want to keep that breathing going. Pet therapy and animal therapy are really effective. So if you have any pets, you might want to make use of them. Rest is very important, and sometimes touch really helps. So Bertha, if you want to give him a good massage, that would be helpful. Positioning after your surgery is very important because you just had your hip replaced, so we want to make sure that you're positioning yourself properly. So some of the things you're going to want to remember is not to flex your hip more than 90 degrees or internally rotating it. Okay? Alright, so with this medication, it's going to block the sensation of pain and sometimes coughing. So you're going to want to deep breathe and cough frequently to make sure that you don't develop pneumonia. It can depress your respiratory system, so that's why we're avoiding alcohol and other drugs like that that are going to slow your body down, okay? It'll take about 10 to 20 minutes to start working, and then it'll work for 30 to 60 minutes at its peak. Once again, we're going to avoid alcohol because that will cause the respiratory depression. Thank you. Don't take any other medications or even herbal supplements unless you tell your doctor.
Okay.
If it's not controlling your pain, or have you talked to your doctor?
No.
Okay, we're not going to take that until we talk to the doctor. If it's not controlling your pain or you're having symptoms that you don't like, tell your doctor because he can change the dosage, okay? You might begin to experience lethargy or sleepiness. Your face might get flushed and red. You might start sweating excessively. Your vision could become blurry, your mouth dry. If it becomes dry, just chew some gum or ice chips. You might get headache or nausea, or your urination might become painful or reduced. If that happens, if that happens, just let the doctor know, okay? Bertha, we're going to have to keep an eye on this lethargy, okay?
Alright.
Okay. So if your hands start to feel cold or clammy, you need to let the doctor know that's a change in your circulation. If you have any changes in your body function or your behavior, or if he starts to act a little crazy, Bertha, you let us know.
Alright, I will.
Okay, thank you.
You're welcome.
Okay. Are there any medications you take at home on a regular basis?
No.
Okay, good. It seems like you're following directions well. When I asked you to get rid of your beer, you were cooperative, so following directions is important with medication, and maintaining the timing of that. You have adequate support at home. Do you have a lot of rugs laying around the house?
A whole bunch.
Okay.
I think how many? I think 5. 5.
Okay, we're going to want to pick up those rugs so that it's not a tripping hazard. And also, I'm going to send somebody to your home to see if we can have some grab bars installed to help you have safe transfer. Because you are going to want to change positions slowly when you do that, okay? If you start to have a change in the quality of your pain, you need to let us know. And also report any difficulty in pooping. If it becomes hard to poop, we're going to make sure we're in the bathroom first of all.
Okay.
And then also we'll use a stool softener to help that process so that we're not straining. Okay, do you have any questions about what we talked about today?
No, only how expensive is it?
Okay, it should be covered by your insurance. You can talk to the pharmacy about that. If it's a little too expensive, they do have some generic forms that you might be able to use. And then otherwise they might have assistance programs that can help, okay?
Alright.
So here's some information that talks about everything that we covered today. You can take that home and look back. Feel free to call anytime if you need any help or you forget anything we talked about, okay?
Alright.
Alright, thank you so
Thank
much,
you.
Brutus. It's so nice to meet you, Bertha.
You as well. I really thank you for helping my husband out.
You're welcome. welcome. Have a good day, guys.
Alright, you too. Thanks.